concerning that. So basically what really, I don't think there was an actual vote taken not to negotiate with the hospital anymore, but what was handled in closed session was an agreement between Somervell County EMS and Pecan Plantation to provide backup EMS service. So we currently have a contract with Pecan Plantation to do all of our transfers. And if there's a situation that arises that Pecan cannot, Pecan has an agreement now with Somerville. Somerville will take the transfers if Pecan is not available. I did explain to the judge that
Exactly.
that does not get us through our trauma situation and getting patients out of here in a timely manner when there's a trauma. So he did ask for the numbers on the trauma. You know, I told him that Somerville could take care of the trauma transfers for us, no questions asked. You know, we might be able to come to some sort of long-term agreement. That's kind of where we are. I will recommend probably at a time in the future, if we can get the board together as a board to discuss and see what y'all, you know, if we want to address this publicly, if we want to put anything out as a whole board, and just have the discussions on options.
How did they decide not to do it without taking a vote?
Yeah, they knew a contract was in the works from us. Why didn't they give us the opportunity to?
I was never contacted. I was never contacted by anybody. I think what happened is there were some numbers presented to Steve Willis that eventually made it to me. I had significant questions in the numbers. The numbers came out to add three, so you'd add 6 total for a cruise. You gotta have 6 people for a 24/7, 365. It would take 6 FTEs to fill that. And the number that I was provided was $140,000 per person, which is, it significantly differs from, there was an ad put out in November by Somervell County EMS for hiring paramedics, and the salary on that ad was $56,000. Now, you know, our agreement would be that we pay for benefits and things like that, but I don't see $90,000 in benefits, and so I question those numbers, but that's, and then what transpired yesterday, it happened since. I think Steve went back to get clarification on the numbers and was told that there was already a plan in place. It's my understanding, as far as the county's concerned, since we signed a contract with Pecan to do, which we had to because Hamilton has stopped doing our transfers. But since we have an agreement in place with Pecan, that it's no longer their concern and no longer an issue. Which is, I did explain to them, we still have the trauma issue that they failed to take into consideration, so.
I'm sorry, I have a quick question. Okay, what happens if Pecan's over here making a transfer and they call for mutual aid over in their area? Will Somervell County go to their area?
There's an agreement there, but what would happen most likely at Pecan is Hood County would respond to mutual aid because it's in Hood County.
And here they are, they're doing things without hiring these other people.
That was one of the concerns of the judge currently is they cannot even staff what they need right now. So looking at bringing on additional staff.
That's what they're told.
That's what I was told by the judge, is they cannot staff
That's what he's.
their current needs, much less add additional staff.
So then what they want is they want this free deal. They don't have to increase taxes or anything. Mutual aid, free.
Well, and the comment was made not by them, but somebody from the fire department, is that it's free, and my response was, it's not free, because now the hospital district is paying Pecan for transfers.
Absolutely.
We have so therefore, either way, the taxpayer,
Right.
at the end of the day, the taxpayer is paying.
But the county's off the hook.
Yeah, I will say the money is going outside of Hood, is going to Hood County for transfers that could be kept in Somervell County.
And it's a lot of money.
It is a fair amount of money.
So is our first response to Pecan?
Right now, our first call is to Pecan.
It's not our own people.
It's not, because they don't do transfers.
They're not our own people.
I will say, from a competency quality of care measure, Pecan is a very good ambulance service.
Have you ever
Most of
talked to
the-
Pecan about their ability to recruit and keep EMS personnel? Do they have an issue?
I will say that they are going for a vote to increase dues, to be able to increase salaries in Pecan. There is a agenda item on the election coming up to increase the dues, to increase salaries to be able to keep. But I don't think their salaries are too far out of line with what, I don't, like I say, I don't know the details of what's being paid here versus what's being paid there. But the number that was provided to the public in Pecan for EMS is not, they put out an hourly rate, and that's not much different than what I've seen advertised here. So, I think, if the board so chooses in the next week or two to call a meeting, if y'all want to address this further, that's,
Let me just ask this, should we wait until after elections? Not that that's gonna make a whole
No,
lot
I
of
don't think so,
difference.
because we're gonna do something, I'd like for that information to be in the public,
I'm
and
gonna,
before the election.
I'm gonna be out the 5th through the 10th. I'd appreciate it if you do it either side of that. I'd like to be involved in this.
yeah, if we posted a meeting, it would have to be, if we posted, the election.
We already have one, a special meeting on Monday.
We have one on Monday, we can add that to Monday's agenda, we haven't posted that
We haven't
yet.
posted that agenda yet.
That's fine.
I don't know if that gives us time to get it out before the election day is the next day, but.
Yeah,
The only other,
we're up against the election already.
Yeah, I think you're.
I'm not sure how the information's gonna get out to make any difference.
Okay.
We'll work on putting an agenda item, if that's the pleasure of the board on the next. Other than that, critical access, I have nothing to report there, we're still anxiously awaiting. I think the more time it's sitting at CMS, the better our odds, but, I check my email every day, all day, just waiting for that email to show up. So, other than that, that concludes my report.
Okay. You will post that once it happens. Thanks, sir.
You will be notified when that happens, I will.
Michael, you did say that this agreement that the commissioners have come to would impact our ability to have the level 4 trauma center. But
Well-
it doesn't impact our critical access?
No,
centers?
it will have no effect on critical access. The agreement that the county approved doesn't really impact that. Well, it just, relying on Pecan for transport, trauma patients, we've got to transport within 30 minutes.
Yeah.
And it takes Pecan more than 30 minutes to get here. So that is not addressed, and that's the thing, and what I called to the judge's attention yesterday is, they thought they had a solution, but that still doesn't address our ability to get our level 4 trauma designation.
And in some ways, trauma is dealt with very differently. We have to transfer trauma patients sometimes that are not critical,
Sure.
right? But it's by definition a trauma. So we have to live within these other guidelines, even though if I had an ER full of really sick people, that person would not be the first one I would choose to put in an ambulance, right? And given the concerns from the fire department about doing non-emergency transfers in their opinion, I will guarantee you that this arrangement is going to be a problem at some point. We just kick the can. They kick the can down the road for years. That's what's happened, I think.
Are you having him, or the attorney who was working on the contract that we were going to put in, are you having?
Or from numbers from the county. Like I said, the first group of numbers I got, I had significant questions, and I wanted to see itemized or line item numbers for salary versus benefits versus retirement, and I haven't been provided that.
I went ahead and notified Kevin what the county did.
I just want to say on tape that I hope that none of our commissioners or judge has to face a trauma or an EMS situation in their personal lives.
I know that two of them already have.
But I'll just say, and I'll say this on the record, that's happened before. And
Yes.
they transferred
Yeah.
because it was commissioner. The commissioner called him and told him, you transfer.
No.
Who gave, did Steve Willis give, did he work up those figures, or was Brian Jones involved in doing it?
It's my understanding that those figures were provided by the county HR person. That's who he was going to meet with to get those numbers.
So, okay, let me ask you this, do you think he was going high in a negotiation to where we can bring him down?
That's why I asked for itemized numbers to compare to what they're, I mean, they put an ad out in November on social media for a paramedic at $53,000 a year. So, and the thing is theoretically you should, them looking at hiring the 6 medics to do EMS only, they should be paid less than a firefighter paramedic because they're only providing EMS service. So I just found those numbers kind of hard to justify. I do know they do have a fairly rich benefits package, but I don't see it being that rich. I could be mistaken, but that's why I asked.
That's fine.
I have not received those.
Good.